slides.
All right, so I'm Bill Pugh, and I'm going to show that you don't need bullet points to give a lightning talk. So I'm going to talk about donating bone marrow. So on my third date with the woman who was to become my wife, she said, "Oh, I have to get back early because I'm going to go to this church where they're doing a registry for bone marrow donation." And I said, "Oh yeah, I heard about that. I want to go with you." Apparently our minds sort of diverged at this point. She was thinking, boy, this guy really wants to get in good. And I just think it was a good thing. At least that's what I now think. So anyway, back in 1990, I just gave a small blood sample to get registered in the National Bone Marrow Registry. 9 years later, I was told that I was a potential match for an individual with leukemia. And they do this it's not based on blood type, it's based on matching your immune system. So I gave, at that point, I went and gave more blood. They did some more detailed matching, and they got back this information that said, well, okay, you are a match for this person, but at this point, her doctors have decided that this person doesn't need a transplant. And I didn't know whether that means she got better or whether she died or what, but fine. And then about a year later, I got another message saying, the person you're a match for, they need a transplant. And so, great. I was, I had no reservations, so I was in this. We'll talk a little bit about the procedure, and actually what it is. So leukemia. Leukemia is a cancer of the blood. It's just like any other kind of cancer, except it happens in your blood. It typically happens like in the stem cells, the parts of your blood that doesn't just die off, but the part that's there citizens. Sometimes with leukemia, drugs or radiation can put it into remission or keep it in check. If it doesn't, if they can't keep it in check, then typically one of these standard last chance treatments is to do a bone marrow transplant. What actually happens when they do a bone marrow transplant for somebody is basically, we haven't had any zombie talk. So they actually turn the person into living dead. Right? If you're going to receive a bone marrow transplant, they give that person enough chemicals and enough radiation to completely kill off all of their stem cells, or as many as they can. And at that point, the person has a walking death sentence unless they receive, within like several days, a bone marrow transplant from somebody who's compatible. So it's a hellacious process for the recipient. But they already got their own problems. But anyway, so I went through this thing. It actually took like about 2 months, all the process. I went through a lot of medical testings. I actually donated 2 units of blood that I was going to get back myself after I did the procedure. A whole bunch of iron pills I take for all the blood I was donating for myself and to prep myself for this. And there are actually 2 ways that they collect stem cells. They can either do it by needles in the hip, or they can give you some drugs that force more blood stem cells into your normal circulatory blood, and then they do something where they take a tube in one arm, they filter out the stem cells, and then put the blood back. There are advantages. Different cancers actually respond better to different types of things. They're moving more now to doing just out of blood, not needles in the hip, but I got the needles in the hip. It was a fine procedure. They gave me an epidural. I slept through the operation. I woke up with a sandbag under my back, and that was to keep pressure on the bones where they had put the needles. And that was uncomfortable, but about the level of stubbing your toe really bad. So it hurt for a couple hours, and I was sore for a couple of days. But that was really all there was as far as my thing. The next day I was at work. Right? Wasn't moving fast, but I was walking around. So if you're matched with somebody, they will not tell you anything more than gender, age, what disease they have. A year after the procedure, if both parties are interested, you can exchange contact information. And I did. And she was doing fine a year afterwards. Met her, and Laura, blanking on her name, and we wound up actually meeting about a year or so after that. One of the things which is really cool about it is that she now actually has my blood and my immune system. Right? If she gives a blood sample, it is my blood. It types as my blood. Her blood type can even change, because that's part of the blood system. And the reason the immune system needs to match, because she has my immune system. If it doesn't match her body, my immune system, which is now in her body, will attack the rest of her body. But because we're a close enough match, that doesn't happen. So anyway, it's now been 10 years since the donation. She's doing well. I don't know if there was anybody else who could have been a match, but I was the person her doctors thought was the very best match for her. And it's cool. And I would like to encourage all of you to not only donate blood regularly, but also to go get signed up for bone marrow. And it's not done automatically. It actually costs money to get registered. Sometimes they'll do special drives. but you'll have to go out of your way to do it. But it's a cool thing to do, and the best easy karma points you can get in.